Well, in view of the rising COVID numbers here, this is what's happening in the state of Odisha, which is also witnessing a COVID surge. The government there has decided to impose night curfew, and this is for 10 districts here. The night curfew coming into effect in 2 days' time, 5th of April onwards. This is going to be starting 10 p.m. in the night, overnight up to 5 a.m. And these are numbers that continue to rise. Let's first get you the national figures here that have come in. They've been the highest ever recorded, not just for this year, but for the past 6 months. These have been recorded at 89,129 fresh cases that we've seen in the past 24 hours. The death toll, though, is drastically less, but is still inching up. It is currently at 714 deaths recorded in the past 24 hours. Now, just yesterday, the central government had flagged off in boiling it down to 11 states which are the worst affected, calling it these are states of grave concern. Observations here that were made at the high-level meeting here. Central government once again warning the states to do enough, to take immediate action here. This is with respect to testing, tracking and treatment, and also other measures here out in public places. But on the worst affected state here, which is the status on Maharashtra, which has in fact nearly got in 48,000 fresh cases in one single day. So that's a huge chunk of the national figures here that we get on a daily basis. Two of the worst affected cities here being Pune and Mumbai. Pune recording over 9,000 cases in the past one day. Mumbai has registered over 8,000 cases here. The Chief Minister, Uddhav Thackeray, in fact, had spoken out in a press meet just late last night there, saying that while they're racing against time, making efforts here to also make sure that medical infrastructure continues to keep up with this demand, with these numbers rising, there will be a time in the coming few days that they would be running out of manpower as well. Though the state government is to take about 2 days' time to eventually decide whether the state requires an absolute lockdown or not. So still it is on the cards of a possibility that could come in. Talking about the bed crunch with those alarming cases here, while the Chief Minister raises a flag, let's get you city by city updates here on the shortage of beds, or the increasingly number in the reduction of beds availability that has now come in Pune, which is left with only 20% of COVID beds. Next is Mumbai, which is left with 27% of COVID beds available. In Nagpur, only 5% of COVID beds, and in Nashik, 35% of beds available there, which are dedicated for COVID treatment.
जर का ही रुग्णवाढ होत राहिली तर मी जे तुम्हाला सांगितलं त्याच्यात मी बेड्सची तुम्हाला कल्पना देतो. साधारणतः विलगीकरणच्या ज्या बेड्स आहेत त्या 2,20,000 आहेत महाराष्ट्रामध्ये. आत्ताच त्या 1,37,549 भरलेले आहेत, म्हणजे 62% हे बेड्स भरले गेलेत. आयसीयूचे बेड्स हे 20,519 आहेत, ते जवळपास 48% आज भरलेले आहेत. ऑक्सिजनचे बेड्स आहेत ते सुद्धा 62,000च्या आसपास आहेत, ते 25%च्या आसपास आज भरलेले आहेत. व्हेंटिलेटर्स 9,347 ते पण 25% जवळपास आज वापरात आहेत. ही परिस्थिती फार चिंताजनक आहे आणि म्हणून मी आज आपल्याशी संवाद साधायला आलो की ही परिस्थिती अशीच राहिली तर आणखीन 15-20 दिवसांमध्ये आपल्याला ह्या सगळ्या सुविधा ज्या आहेत त्या अपुऱ्या पडायला लागतील.
That's the update coming in directly from the Chief Minister here, but there's also the other aspect to this, which is with respect to blood shortage. Now, given the fact that we've already seen one past year of the pandemic where blood donation was drastically reduced, which means stock availability of blood in blood banks has reduced as well. And this coming in at a time at a corresponding increase in the demand of blood here with respect to plasma therapy, which is also sometimes used here for COVID treatment. The figure that we have while speaking with the state food and drug minister is that blood donation has been only 20 to 25% of the past 1 year, and this is because of the rampant rise in the demand of blood that we've seen.
The issue of blood shortage has come up yet again in the state of Maharashtra, with the state having only 6 days of blood stock available across all the 373 blood banks. In fact, when we spoke to the FDA minister, Dr. Rajendra Shingane, he clearly said that the state has roughly about 20,000 blood units available, and it records a demand per day of 3,000 blood units. So if you talk about the calculation here, then clearly the state is left with only 6 to 7 days of blood stock, which is really alarming, because currently, due to the COVID surge, the demand has increased of blood here, and the FDA minister says that it is getting very difficult to meet the demand and supply of the patients in here, because apart from the COVID patients needing blood, there are also other surgeries that needs to be conducted, the accident patients that come into picture, plasma therapy which is done by the COVID patients, and rest other surgeries do require blood. But at this point in time, there is a shortage of blood, and the reason here is that compared to last year, the blood donation camps have been reduced by nearly 70%. So this year, in the last 2 to 3 months, roughly about 20 to 25% of blood donation camps have been conducted, and that is why we are looking at a shortage of the blood. Now, why the blood donation camps have reduced is because of numerous reasons, but the top, of course, stands of COVID. So due to COVID, of course, a lot of things were being done from home, like institutes, colleges, universities, NGOs. Most of them were working from home, so not a lot of them were stepping out to donate blood. The FDA minister also says that currently there's a fear amongst people to come forward and donate blood due to COVID, and that is why they are not looking at blood donations heavily as compared to what they saw a year ago. In fact, the data that we have access further also talks about that in 2019, the state of Maharashtra had collected close to 70.23 lakh blood units, which significantly dropped to 15 lakh blood units last year, and that drop was also seen due to COVID. And now, of course, till March, roughly about 4 lakh units only have been registered. So if this, of course, situation prevails further, FDA minister says that it is going to be very difficult for the patients as well, and now an appeal has been made to all the 373 blood banks to create an awareness so that more donors can come forward and donate blood.
Our correspondent Disha is getting us all of those inputs of the medical challenge that the state of Maharashtra faces yet again. It's a wrap of the show here.